your night?
It has been pretty good. You have Miss Woods, right?
Yes.
Okay. Miss Woods is a 26-year-old, pleasant-looking lady. She has been really cooperative the entire night and tolerating finger sticks and insulin shots. No difficulty with PO meds or anything. She has a full code with no known drug allergies. She has a past medical history of type 1 diabetes. It's just been recently diagnosed for about a month.
A month?
Mhm.
Okay.
She also has a history of UTI. She has 2 IVs, which is going to be great for you to work on. She has 20 gauge in her left forearm. It's infusing insulin drip. Another one she has is 21 gauge in her right hand, and that's saline lock. The rate was adjusted for her insulin drip at 600 after her blood sugar level was 132. We expect that her insulin will be discontinued today because her blood sugar has been stable and controlled. She is in consult for the dietitian and diabetic educator today to teach her carbohydrate counting and her ability to perform glucose checks and insulin administrations. She's also going to be educated for sick days, diabetic checks, because her UTI has caused exacerbation of uncontrolled diabetes management. Patient's family was not here overnight, and we're expected their visit today. Her breakfast tray should be coming in shortly, and I'll take it to her room whenever it's available, and we can go meet her and check her blood glucose level before she eats.
Perfect.
And her physician is Dr. Henry.
Okay.
We also have the consult with Dr. Ritter for her endocrine. Do you have any question for me?
No, let me just look at the orders.
Okay.
Okay, let's go in.
Miss Woods, this is Miss Ashley.
How are you doing this morning?
She's going to be taking care of you this afternoon, and you take care, okay? I'm going to be taking off.
Okay, well, you have a good evening.
Thank you. It was great working with you all night. You have been really good, patient to me.
Oh, thank you. That's
All
good.
right. You take care, all right?
Okay.
Your breakfast is coming in a few minutes.
Okay, do you know what we're having for breakfast?
Well, I'm not sure. I can look at it and let you know. How about that? Okay? All right.
And do you have any concerns for me while I'm in here?
You know, I've just been having this headache. That just
Headache?
Like, it just won't go away.
Is it throbbing? Is it in a certain part of your head?
It's kind of just like all over.
All over?
Yeah.
And on a scale of 1 to 10, what would you rate that? 10 being the worst.
That's a 6.
A 6? Okay. Let me see. Check your orders and see what we can get you for that.
Okay.
And then we've got a busy day of education today. You know, your recent diagnosis, there's a lot of information. If you need any help or need me to clarify anything, just ask, okay?
Do I have to have any homework?
Oh, no homework.
Okay.
We just want to make sure you understand everything so we can treat this the best way possible, okay?
Okay.
All right. Hi, Miss Woods. How you doing? How's breakfast going?
I don't like any of this stuff.
You don't like any of it? Is there anything else I can get you?
Maybe some apple juice
Apple juice?
or something.
Okay, well, I have your Tylenol with me. Are you wanted for your... Miss... Are you okay? Are you okay?
Sleepy?
I'm going to go ahead and check your blood sugar, okay, real quick.
All night. She didn't get any sleep.
Oh, I understand that.
Yeah, it's night sleep time.
Just relax for a minute. I'm going to just prick you and see where your blood glucose is at, okay? Does she normally act like this in the morning? It was different?
Not normally.
Okay.
But she was telling me she didn't get much sleep last night.
Okay. Are you feeling dizzy at all?
Just
A little tired? Feeling
sweaty.
fun? You're sweaty. Yeah, you are pretty sweaty.
I don't like sweating.
Okay, it says your blood sugar is 102, all right? So can you try and drink this juice for me real quick?
I'll try to drink the juice, but are we going to have anything else for breakfast?
Yeah, I can get you something.
Yeah, that's
Let me just get a quick listen to you, okay? Miss Woods, you hanging in there with me? You tired? Miss Woods? I'm gonna go grab another nurse, okay? I need help. Wake up. Okay, we're gonna check her blood glucose again, okay? We're gonna have another nurse help be verified.
She's just, I don't know what happened. Can't ask her what happened. Miss Woods?
You know, she went unconscious, so.
Are you checking her blood sugar? What's her blood sugar? Miss Woods?
63. And the order is to give
Miss Woods? Can you hear me, Miss Woods?
the bolus, right? The 50.
Okay, here.
So we're gonna give
Let
her
me
some
get
more
it
of her
real quick.
medication to try to bring her blood sugar up, okay?
Oh, shoot.
Miss Woods. In the hospital, okay? Your blood sugar got a little low, okay? You fell asleep.
How long was I sleeping?
Not very long. Could you tell that you were feeling a little shaky or anything before?
My hands kind of was feeling a little jittery.
A little jittery?
Like,
Is that the first time that's ever happened?
well, when I was 7, I ate a whole bowl of sugar just to see what would happen, and it kind of felt like that. My hands wouldn't stop shaking.
Yeah, I understand. Now it's important that you kind of recognize when you're starting to feel like that and sit down or maybe tell someone so that you don't pass out and no one's around to help you, okay?
So what happened?
I came in to check your blood sugar, and since with your insulin drip and that you weren't eating, your blood sugar got really low. And your blood sugar got too low for you to stay awake and you passed out.
Does that happen normally?
Not normally, but I mean, it's one of the complications with diabetes, and that's why we have to manage your blood glucose so well, okay?
So what happens now? What do we do? What they do?
We're going to have someone come in and talk to us today and educate
you're
us
gonna have
so we
a
know everything.
Dietitian and
So we can go home and do this better.
the diabetic coordinator come in and talk to you, okay? So that we can make sure this doesn't happen again. Because if we stay on top of your blood sugar and keep it within range, we shouldn't have any complications.
So what other is that why I have the UTI? Because it kind of burns when I pee.
That's not necessarily related. The UTI is something different, but we're also going to talk about how you manage your insulin and your blood sugars while you're sick too, okay? That's something else we're going to address. I know it's a lot of information,
Okay.
but I'm going to have a nurse stay in here with you, make sure you're okay, and I'm going to call your doctor and let them know what's going on, okay?
Okay.
Ashley, did you need some help?
Yeah, can you watch her? She just lost a little bit of consciousness, and we gave her the insulin per protocol.
Okay.
Just hang it out with her while I go talk to the doctor, okay?
Okay, sure. Hi, Miss Woods.
Hi.
How are you doing?
I don't know. They said I passed out, but I don't remember anything.
What happened?
Dr. Henry? Hi, I'm calling about Miss Woods in room 302. Yes, the diabetic. So I went in for her morning assessment, and she was a little drowsy, but we checked her blood sugar, and it was 102. I gave her some juice, or tried to give her some juice, but she went unconscious when we rechecked. Her blood sugar was 63. So per the protocol, I gave her the 1 amp of D50 IV bolus. I have a nurse in there with her right now. Is there anything else you wanted me to go over? Okay, I just wanted to give you an update. Thank you. How's she doing?
She's feeling just...
You feeling better?
Yeah,
Any shakiness?
No, not as much as I had. I still kind of
You sweaty or anything?
feel a little funny.
A little funny?
Yeah, but not as bad.
Okay. Well, make sure you're drinking your juice too, okay? I'm going to check your blood sugar again. How about your headache? Is that any better, or is that kind of worse from everything going on?
You know, it's just still just kind of everywhere. And it's, but it's not throbbing the way it was
Okay.
before.
So it's getting a little better.
Are you having a double vision or something?
A little bit. It's just kind of fuzzy.
Well, it's important as a if she starts getting where she's like looking like she's going out of it or getting lethargic, make sure you press the call light and we'll come in, just in case we're not in here.
Okay.
But let's check and see where she's at right now.
I know you don't like those pricks. It's okay.
It's at 132, much better, okay?
Okay.
Is there anything else we can do for you?
Can you make those sticks not hurt so much?
I wish I could. Now you can look into getting a pump. That's something that you can talk to the diabetic coordinator about.
Yeah, 'cause it hurts. I feel like a pincushion.
Well, I think she's out in the hall. I saw her walking around. I'll see if she's going to come in and talk to you, all right?
Okay.
How's that sound?
Look, Mom, I look like a beat up red tomato.
It's okay. We don't want you falling asleep like that again, though, so it's okay. You'll get used to it.
She did something.
All right, well, let us know if you need anything. I'll send her in.
Okay, thank you, ladies.
Hi, Miss Woods. I'm Janice, the diabetic
Oh,
coordinator.
nothing
How are
in
you?
this thing
Oh,
just got
nothing?
pricked.
Oh, okay. Is it hurting you?
Well, I just don't want to get blood all over you.
Oh, okay. Well, I have some information for you about hyperglycemia, okay? This is some of your discharge papers. You can keep that and we can go over it together. First of all, I want to tell you to, whenever you get sick, then you don't want to stop taking your insulin. It's very important that you stay consistent with your insulin, okay?
Well, if I'm not eating, why do I have to take my medicine?
Well, your blood sugar levels may continue to rise even if you do not eat. So when you want to test your blood glucose more often, if your levels are unstable, you want to increase the frequency to like every 4 hours. And if you want to make you more comfortable, it could be every hour. But at least every 4 hours you want to check your blood sugar, okay?
Okay.
Okay? You can just follow along with me.
Do that.
Does that sound like something you can do?
I don't want you.
Hmm?
I don't want you.
Will you have family there? Are you?
I'm her mother.
You're the mother. Okay, will you be there and kind of helping her with the...
She lives at home still.
Okay, all right. Okay, and you want to drink lots of fluid because it's easy to become dehydrated when you're ill, especially if you have a temperature or vomiting or diarrhea. Okay, and if you're unable to keep fluids down, you want to call your doctor. Because you can also lose fluids from sweating and breathing.
I think I just lost 3 pounds just this morning.
Okay, well you still have to take your insulin, okay? It is very important. You want to stick to your normal diet as far as possible, and if you're unable to eat solid foods, then you want to take some liquids, okay, or even sugary drinks if necessary.
Liquids like what?
Liquids like orange juice.
Can I have soup?
Can you have what?
Soup.
Yeah, if you want soup, you can have soup.
Like,
But you make sure you check your blood sugar, okay, and give yourself insulin.
yes, ma'am.
All righty. And you want to try to drink 4 to 6 pints of sugar-free liquids throughout the day, like water or tea. Okay? Okay, so that's mainly all I have for you. And if you have any questions, you can always give me a phone call. Here's my card. Okay? Do you have any questions for me now?
What should I look for as far as if my blood sugar gets too low?
If your blood sugar gets too low, then what you want to do is make sure that you have like some candy available, some hard candy available, some orange juice, because you'll start to get like tremors or a little confusion. So that's why it's very important that you stay on top of your blood glucose check, because you want to catch it before it gets too low. Okay?
Yeah.
Okay. Anything else?
My daughter has kind of a sweet tooth.
Okay.
If she has a little too much sweets in the evening,
Mm-hmm.
what should we do?
Well, you should have a sliding scale insulin also that your doctor is going to prescribe to you. So if your blood sugar is high, you want to make sure that you're looking at that sliding scale, and it goes by numbers, and in between numbers, then you give that much unit of insulin.
Mom, you weren't supposed to tell on me.
Did you have any other questions? Don't be afraid to ask.
How long do I have to put up with this?
Probably for the rest of your life.
Okay.
This is probably a lifelong thing, but you can do it. You can do it because it's been done. Okay?
You'll be fine.
Can I still have my chocolate cake?
You can still have chocolate cake, but you want to make sure that you check your carbs. Because the nutritionist talked to you about your carbs, right?
Yeah, she came in here briefly and
Okay.
talked about it. As long as I can have chocolate cake, then I can live.
Okay. Well, you stay on point checking your blood sugar.
Okay,
So
now
you won't be back in the hospital soon, okay?
now, why does it hurt? Do they always have to use this area here? Can I just prick myself like right here in the middle, or you know?
Well, they
is
always
there
teach
someone
to do it
supposed
on
to
the
do
side. And you don't have to use the same finger. You can use different fingers.
I feel like a pincushion.
Yeah, sometimes it's painful and sometimes it's not. But try to switch sides, okay?
So what
Don't
about,
use the same finger every time.
so what about my insulin? Can I put it anywhere? Or?
Well, yeah, you can put your insulin in your abdomen. You can put it in the back of your arm. Have you been giving insulin, or who's been giving insulin
Well,
to you?
I've been doing the
Nurse.
insulin, but I just
At
haven't.
home?
Yeah, I just haven't been taking it. I'm not really used to all of this.
Okay. Well, with your insulin, what you want to do is make sure that you switch sides each time, okay? You can
Is
go
there-
abdomen, from the right abdomen, the left abdomen, the right arm, the left arm.
And is
Just
there a
switch
certain
sides.
way that I'm supposed to
Well, you just kind of pinch it, and you hold it at a 45-degree angle. Your needle.
I got enough to pinch, so.
Okay. Okay. Well, is there any more questions that you have for me?
I guess that's it for
We
now.
got your
Okay.
card. Thank
All
you.
right. Call me. Thank you.
Thank you.